part of the idea about one concern about isolation is coming to a clinic visit and bringing a friend, someone who can take notes, someone who can help ask questions, someone who can also kind of feedback afterwards as you process about the clinic visit. Here's what I heard. Is this what you heard? Asking your doctor if they have an electronic medical record, there's a thing called an after-visit summary. Have them type up something up so you can actually take home from the visit. Having a clear action plan. These are kind of things which make a clinic visit, I think, really good. Coming in, that you have the more ears, the better. The more mouths for asking questions, I think, the better. Use of the timeout sign for if you're feeling stressed, and just doing a deep breath, coming back. These things are all helpful, I believe. The idea of also understanding that every clinic visit can be a potentially very stressful event. And if we're stressed, we're less likely to remember what took place. Cortisol actually does have, which is our stress hormone, one of them, actually does have an effect on memory. And so another reason to have a friend present, or have, and seeking out a health coach, a healing coach, someone who has experience maybe in guided imagery or visualization, biofeedback, breathing techniques, meditative techniques. These are things which are acquired skills. So one of the biases I bring to my clinical practice is skills before pills. And so, do I prescribe medications? Of course. Do I work very hard to address fundamentals so medications aren't needed? Absolutely. And I think that one of the greatest things I see is people living in a state of anxiety, of fear. And that tends not to be as helpful as possible. It's helpful if there's a saber-toothed tiger around the corner here, then it's good to have fear and it gets our body going so we can run, but we need downtime from that too. We're not meant to be in a constant state like that. And a lot of fear and anxiety I've seen in people isn't being constructive. It's keeping them from sleeping, it's keeping them from enjoying life. It isn't keeping them out of trouble. It isn't keeping them out of danger. So people ask themselves, is this constructive? Is this healthy? Is this something you can invite into your life and you can invite to leave your life? It's possible. And so different techniques for addressing that. I happen to not be very flexible, but if someone like myself can do yoga, then most anyone can do yoga. If someone like myself with an active mind can do meditation, then it's true for other people as well. The idea is that certain things can prepare us for meditation, and yoga is one thing which has been understood to prepare people for meditation. Things which can calm the mind. Do I sometimes use supplements to help calm the mind? Absolutely. To help people bridge to a space of calm where that can be helpful. My colleague Henry Emmons has recently written a great book, The Chemistry of Calm, and a mixture of Eastern and Western medicine from the perspective of a practicing psychiatrist who does not often use pharmaceuticals. Very, very powerful part of his resilience training program.